Welcome to another Instagram live chat. We're waiting here for a very special guest today, Erin Skipley, and Erin is going to share her great story with us, and I'm just waiting for her to join here. So, hope everybody had a nice weekend. I'll just give you a little preview of Erin. She is a celebrated permanent makeup artist, and she wants to tell you her story, and here she comes. I can see her name popping up. Just waiting for her request.
Hi.
There she is. Hi. I almost wore something that would match your hair today, Erin.
Oh, I love it.
I thought about that, and then I thought I'll just be boring and go with my Celluma scrubs.
Oh, well,
Anyway,
looks very professional.
well, it's lovely to see you.
Thank you for having me.
Of course. Welcome. So I just introduced myself. Let me do that again. So I am Denise Ryan, Vice President of Brand Management here at Celluma at the global headquarters in California. And I am welcoming Erin Skipley. And Erin, why don't you go ahead and introduce yourself and also tell us where you're at and tell us about your two locations.
Sure. My name is Erin Skipley. I am a celebrity makeup artist in Los Angeles, as well as a permanent makeup artist and educator. My business is called Contour & Ink. I have two studio locations, one in Beverly Hills and the other in my hometown, Seattle, Washington. Oh gosh, let's see what else. I've developed my own training programs and techniques focused around hyper-realistic enhancements for brows, lash lines, lips, and skin. I have 20 years in the beauty industry, and the last few years I've been fortunate to work alongside two cosmetic dermatologists doing cosmetic tattooing procedures.
Oh, wow.
So I'm so excited about Celluma and the technology and bringing it to my industry. It's probably already here, but for those who don't know about LED technology and Celluma, I'm really excited to share. It's made a big difference.
Okay, well, that's great. So tell me a little bit about what you learned working alongside the dermatologists. I'm kind of interested to hear a little bit more about that. And then what I'd love you to do is tell me how you found Celluma and your first experience with it, and then just kind of take us through that story.
Sure. Well, being in the beauty industry for so many years, you're constantly hearing about new techniques, seeking out new beauty treatments, what's working, what's not, I feel like my experience working with the dermatologists, it really gave me, well, and also, working in that environment, I got to be somewhat of a guinea pig for different, like, ablative lasers or non-ablative lasers, and definitely treatments where the healing process was pretty gnarly, and I didn't leave the house for a week because I looked crazy. And this was before I experienced these treatments for myself, these different laser treatments, before my introduction to Celluma, and I just so wish I would have had that technology at my fingertips at that time. I think as permanent makeup artists, it is the one tool that I feel like has been the missing link all along in preparing the skin for these types of traumatic procedures. So the way that I found out about Celluma, a very highly respected colleague of mine, Kathleen Crawford, her name is, she's another celebrity artist and came to my studio to give me a ProCell treatment, which is a micro-channeling, micro-needling service. She's a good friend of mine and wanted to introduce me to this technology with this. She brought the Celluma Pro, and I was thinking, what's happening here? I've kind of seen these devices out in the market. It can be very overwhelming to when things pop up on Instagram or you know, these like face mask things and like, what is this light therapy thing? It looks kind of scammy on certain platforms. And then you see devices where it's actually medically proven to improve the skin texture and clarity and etc. So anyway, she brought this device to my studio, the Celluma Pro, and gave me a ProCell treatment. And as is normal, my skin was red and pinpoint bleeding and slight swelling. And I'm just looking at this panel going, you know, my skin hurts, it feels sunburned. Like, what is this panel possibly going to do for me at this point? I look a little bit crazy, and I guess I'm going to be in for the evening. So that wasn't the case. 15 minutes under the Celluma, my skin, the pain had diminished completely. 30 minutes under the Celluma, and the redness had almost completely vanished as well. So, you know, after that treatment, I looked like I had just stepped out for a walk after this microchanneling treatment where I had needles stamped into my skin repeatedly. So I was obsessed and fell madly in love with the technology at that point. And I just thought, I need to bring this, I need to incorporate this into my permanent makeup work somehow. And that's exactly what I did. I immediately bought a device and have been using it ever since.
Wow.
And with amazing results.
Yeah, well, that's a wonderful story. You had such a personal experience with it first. And that's always a great place to start from, because then you can really speak from a very authentic place when you're sharing it with your own patients or clients. I think until you experience the benefits of a true, proven medical device like Celluma light therapy, it's hard to imagine, especially if you've used some of the sort of junky stuff you can get online, what a difference a device like this can make. And how quickly. I think that's the other thing that's really amazing for anybody out there like yourself doing mildly ablative or even deeply ablative, like you spoke about earlier, treatments. It's so amazing to see what a difference it can make in the recovery and healing process. But of course, also in the appearance and the comfort level for your clients. It's great that they can maybe come into you, and you should tell us a little bit about your permanent makeup services, but they can come into you for something that's as invasive as it is, and perhaps walk out not really feeling or even looking like they've had a treatment apart from the benefits of the treatment. Exactly. So that's really nice.
Yeah, I feel like this is just such an important technology for what we do as permanent makeup artists because of the inherent risks of scarring, of hyperpigmentation, hypopigmentation, overworking the skin, over traumatizing the skin so pigment doesn't retain. All these are factors that we are constantly working against. And, you know, I think this is part of a solution to that problem, is properly preparing the skin, improving the cellular function before we even get started, and then also afterwards accelerating that process where the skin is rejuvenating itself.
Right. So were you always using it before and after? And if you have the choice, do you mostly use it afterwards?
No, well, you know, I started using it afterwards because that was my experience during the ProCell treatment. I hadn't even considered using it before. So I had watched several of your IG lives with Patrick, your CEO, and heard other people chat about using it beforehand to energize the skin before, you know, just to help, like, for example, if you're going to go have a facelift, you know, using the Celluma beforehand to prepare your skin to be able to heal itself afterwards. I just started to do the math on that, and I was like, oh my gosh, this is exactly what needs to happen in permanent makeup procedures. Because there are some things like removal where you wouldn't want to speed up the healing process, but you do want to prevent scarring and help the skin heal afterwards. So that's in one area I just started to use it before instead of after. And now I'm using it before, 15 minutes before, and say maybe 15 minutes after the procedure.
And you do it right afterwards?
Right after.
Right afterwards. Okay. So, and a question we often get asked, and you're the perfect person to answer this question, is given that you're using inks, people are often concerned that don't have the experience. They're concerned that maybe there will be a fading of the ink. My understanding is that it's perfectly safe, but can you address that, Rachel?
I can. So we are actually using pigments, not inks.
Oh, okay.
In our procedures. Sorry, I'm grabbing my phone charger. I thought I could do this on my laptop, and turns out that's not the case. Sorry, excuse me.
That's okay. The phone it's going with you wherever you are.
Yes. Okay, just want to make sure that I'm going to be good here. Right, so like tattoo artists use inks. We use pigments, typically like iron oxide pigments or hybrid pigments.
Okay.
And
so have you, so I guess the question is there any adverse effects, whether you're using ink, if you know, or pigments, to using the light therapy right away? That's a question we are asked all the time.
I have never had anybody experience any adverse reactions.
We haven't either, but we're not experts on pigments and ink. But it's just we know it's quite widely used, and we've never had anybody say anything other than it helped. And we've always heard that there was no problem with it changing colors or anything like that. So that's all very positive.
No. I've had no problems with the pigment changing color or fading faster. You know, I've read so many articles. I've seen things pop up on certain colors of inks, like say black ink being more sensitive and clients potentially having a burning sensation with tattoos. Now, it's a different substance being placed in the skin, so I don't know if that really applies to this conversation with pigment, but I've never experienced that, and I've had nothing but great feedback from my clients. Yeah, they seem to heal beautifully.
After a permanent makeup session, do they come back for a touch-up a month later, or they do? Okay. And do you use light therapy after the touch-up? Is it even necessary at that point?
I do. I mean, I think I would recommend using it whenever you're about to impose trauma on the skin.
Right.
So we're doing the same procedure over again in the same area.
Okay.
So,
and do you recommend in between that first visit and the 1 month follow-up, is it necessary or not?
To use it in between services?
Yeah.
I mean, I think there's no, there's only benefits to using it more often.
Yeah.
Do people want to come in for that? You know, just to sit under the light? I haven't invited anybody to do that, but I suppose I should.
Yeah. Well, you have a different specialty. So tell us a little bit about, because you're an educator in this area, tell us a little bit about your classes and your courses.
Sure. So I teach all aspects of permanent makeup. I teach microblading, machine work, powder brows, lip blush, lash lines are my specialty. All of my techniques are centered around natural beauty, less makeup-y looking techniques, and more natural enhancement, undetectable enhancement, where you see just the person looks great, you don't see the tattoo. So I've adjusted the techniques that I've learned over the years to become more, I don't know, less visible, I guess you could say, to the eye, and that just blends seamlessly into your natural features. So I have several courses that I'm about to launch, online courses. Most of my training is in person. I also offer private training and coaching, and in both Los Angeles and Seattle.
So that I was just going to bring that up, that you divide your time between two very different geographical areas. So tell us a little bit about that challenge. Are you flying these days, or how does that work?
I'm actually driving these days.
Oh.
This will be my second time that I'll be going up to Seattle this month in the car.
Oh, goodness. Well, that's a long drive.
I'm still a little distrustful of flying. Being in an enclosed space for that long with other people is a little unsettling.
Yeah.
But
I was flying 2, 3, 4 times a month, and I haven't flown since March, and I have really no desire to, so I'm trying to avoiding that at all costs. I do want to point out we got Ink Imagined on here, and do you know Ink Imagined? Is that
I do.
You do? Okay. They say I have clients who come in just for the light, and they say it makes them feel better. So that's a nice comment. I want to go back here and see. I see Jen Sandoval is waving. We know who Jen is. We love her. She's your Celluma clinical specialist. And then Tic Tac said, do you use light therapy before or after the permanent makeup process? I think you answered that, and I think you do both, but if you can only do it once, you do it afterwards, correct?
Right.
And then Modern Image Wax is saying, can Celluma be used daily? Absolutely. Celluma can be used daily. Our official protocols are 3 times a week. And the reason 3 times a week works is because when you do a light therapy treatment, the benefits from that one treatment upregulate the production of ATP for several days. So you're getting a benefit every day, even if you only do it 3 times a week. But if you feel like you would benefit from more, especially if you have acute trauma or an acute accident or something like that, and you want to use it more, you absolutely can. So that's not a problem. I want to see what other questions jumped in here. Okay, that's it. No more questions. Goodness me. Okay, so let me see. Is this one? We got that one. I love to answer the questions if we can. And scrolling all the way back. Somebody said, you look great. I'm sure they're talking about you, Erin. You do look great. That's great. What's the right? Somebody is saying, with love, Tiff, hello, what's the right price to charge for LED therapy? That's kind of a tough one. Tiffany, I presume your name is Tiffany. We don't know what area in the industry you're in. I'm sure that Erin's charges might be quite different from a dermatology office, which might be very different from a solo esthetician, which might be very different from a med spa or a day spa. So I'm going to answer it and then give you a guideline, and then I'm going to have Erin give a range or something like that. I'm sure your rates maybe in Beverly Hills are quite different from Seattle, so I'm guessing that demographic makes a difference as well. But one of the ways that we guide people, because we're guiding people all over the world in terms of what to charge, so whether we're in the UK or Australia or the US, we always say that it seems anyway that around $2 per minute is a good starting point. And that would mean if you're doing a 15-minute treatment, you're going to charge 30. If you're doing 30 minutes, it's going to be around 60. And then you really have to consider, is that too much for my demographic or my clientele? Or is that just not enough? If you're in Beverly Hills or you're in London or you're in Paris or New York, your rents and all of your overhead are going to be so much higher. So you really have to take all of those things into consideration. And again, are you the only practitioner, or do you have a staff of 30? The more services you offer, the more sort of prestigious your menu of services, probably the more you can afford to charge, but you just have to take all of those into consideration. So I don't know if you have any advice. We don't need to know your particular rates or anything that's proprietary to you, Erin, but if you want to guide maybe some of the practitioners online and
Sure.
what they might charge.
You know, I've incorporated the cost of the service. I've incorporated the cost of the Celluma service into my permanent makeup services. So I don't necessarily sell it as a standalone service. I think if I did, I would probably price it between $50 and $75 for the session. But at this point, I'm incorporating it with the procedures.
Okay, and that's what a lot of people do. And again, it depends on the services. You're using it following a particular procedure to enhance the outcome and the comfort level for your client. So that would totally make sense. Now, somebody asked a very interesting question, and I'm trying to find it here because I don't really understand it, but it may be directly for you, Erin. It says, do you use light therapy elsewhere in the body, say on a freckle procedure on the abdomen?
I mean, I think you could use it anywhere on the body. That's the beauty of that device, is that it's flexible. You can use it anywhere on the body. I mean, for any type of permanent beauty procedure.
Okay, very good. Let me see, was there another one? Trying to find another one. Okay.
I'd really love also for you to speak to what's different about the Celluma, because there are so many devices on the market, and I think that can be overwhelming for artists when they go to shop for a device. I know there's a lot of things that are different about Celluma, so I was hoping that you would talk about that a little bit more as well.
Yeah. Great question, and probably our most frequently asked question. So Celluma is different in so many ways. I would say the primary difference is its patented shape-taking design. So it looks cool. I wish I had one here. I should have brought one, but it looks cool that it's flexible and shape-taking. You have one, Erin? There you go.
I got one right here. We're stuck.
So it looks cool that it's shape-taking. But why is that important? It's not just because it looks cool. That's not what makes it relevant. What makes it relevant is that shape-taking aspect allows it to be curved over different parts of the body. And let's face it, no part of the body is flat. So whether you're following a facial treatment like the way Erin uses it, you can curve it nice and close to the area and provide an even distribution of the light energy, regardless of whether it's over the nose or the cheeks or the forehead. You can also place it, because of that shape-taking design, you can place it in what we call the S shape, which allows it to curve over the face, neck, down under the chin, and down to the décolleté. No other light therapy device can do that because they're basically flat, rigid panels. So that's a huge difference. And it's also large enough to cover these large areas. So our larger panels and even our smaller panels are basically ear to ear and chin to either hairline or chin to eyebrows. And so all of them are large treatment areas, and that's really sets it apart from the smaller handheld devices. It's also the only one that's got the most medical credentials of any LED device in the world. And that should be really important to those of you like Erin who are professionals, and especially if you're educators. You want to be working with and recommending a device that you know has been reviewed by many different medical device authorities for efficacy as well as safety. So whatever we say Celluma will do, you know that it has been clinically proven and reviewed by agencies like the medical device authorities in Europe or by the FDA to do what it says it does. And you also know that it's safe. You also know that it actually is emitting specific wavelengths of light. I always tell people that are shopping in certain online venues to be careful that you're not buying a device that's literally colored glass, because you can't tell that with some of the devices, especially those really much lesser expensive devices. You really don't know what you're getting. So getting a proven medical device, getting one that emits blue, red, and near infrared is really, really important, because when it comes to skin issues, you really need the red and the near infrared, because those wavelengths reach deep enough into the dermal layer to reach those target cells to affect changes in skin, regardless of what you're treating. You have to be able to reach deep enough into the tissue to make it to make a visible change. And then we need the blue light to kill P. acne bacteria if that's a concern. Mm-hmm. And then if you want to treat pain, which we know that LED light therapy is excellent for treating pain, you need the deeper reaching near infrared, which upregulates tissue all the way from the epidermis through that dermal layer and into the subcutaneous layer, where the muscle and joint, or the muscle and joint layer, to attenuate pain issues. So when you get a Celluma, you're getting a device that does all that. You can treat a variety of skin conditions, you can treat pain conditions, and you can treat acne. And if you're like Erin and you're going to use it post, I'm going to call it a mildly ablative procedure, permanent makeup, right? You wouldn't call it deeply ablative.
No, it's not. It's fairly superficial. We implant at the beginning of the dermis.
Right. So so in that respect, and she has found it very, very helpful in helping the tissue heal and repair, and more importantly, I think, helping your particular patients walk away much more comfortable and ready to go out into the world again.
Right.
So it's also completely portable and lightweight. That's the amazing thing. Even the larger panels, they weigh 1 pound. If you include the power supply, it weighs 1.5 pounds, and that makes it possible to take it anywhere. We also have the new I series. The I Pro and the I Lite are now battery powered, which means you don't need, it works like your phone. You don't have to be plugged into a wall outlet. Now, that may not interest everybody, but we can tell by the number of devices that we have sold in the first few months of having this device available that is a super popular aspect. And again, Celluma is the first device with this kind of innovation that has made it possible to use a light therapy device outdoors. A professional, I should clarify there. There's lots of handhelds that are battery powered, but this is a professional size, professional grade, medical grade LED device that you can now use. You could take it hiking. You could take it anywhere you want, and as long as it's charged, you don't need to be at a wall outlet. So people are really enjoying that aspect of it. We also have 11 different models. So if some of our devices are too expensive for you, the lesser expensive devices emit the same power and will give you the same outcomes. The treatment area may not just be quite as large. And then we also have full body devices, which nobody else has a full body device unless you buy a bed. But the beds are very bulky. They take up a lot of room. They actually have to have their own room dedicated to a bed. So our full body devices allow you to hang them on the back of the wall or the back of a door when not in use. And you can still use the room, but you can also, when those devices are called our Deluxe or our Deluxe XL, it allows you to treat the body from head to toe. So that's been a really nice benefit as well. And for professional devices, Erin, we're also the least expensive devices on the market. So a lot of times people feel like with lesser expensive devices, you're not going to get the quality that you pay for what you get. But the advantage with us was that we came into the market and were able to take advantage of new advances in LED technology. It's kind of like the way smartphones have evolved. I remember when the BlackBerry came along, nobody could believe the difference and what a BlackBerry could do. But today we would never buy a BlackBerry, even though it would work and it would still be a good phone. Today, the advances in smartphone technology has enabled our phones to do so much more in smaller phones that are capable of doing more. So here we are on a live IG through our phone. It's amazing.
It's amazing.
And it's the same. It's the same thing with LED technology. We were able to use small microchips to dispense with the large, bulky stands and boxes that were on the traditional older style LED devices. And that enabled us to dispense with $10,000 worth of equipment that really didn't do anything to enhance the outcome. So all of our focus went into the LED panel itself, because that's what makes a difference, not what's holding it, not the stand. The only thing that makes any difference is the components of the LED panel itself. So you want the correct wavelengths, you want the correct output, you want the ability to get it close to the tissue, because that enhances the ability of the cells to absorb the energy. If the cells can't absorb the energy because the light is positioned too far away, then you might as well not be doing the LED treatment in the first place. So power output, dose, the correct wavelengths, that flexible design, the cost factor, all of those really set Celluma apart. I hope that was enough.
That was great. That was great. Because I have my students ask me, you know, why the Celluma, and there's all these other devices. And I mean, that's exactly all the things that I've said to them, you know. I also understand that Celluma is the only FDA approved device that treats the area with red, blue, and near infrared simultaneously.
That's correct. Is
that correct?
Yes, it's the only device that's FDA cleared to treat with those three at the same time. So there are other devices FDA cleared as well, but they're treating with red only, or red and blue, or red and near infrared, but it's the only one that's FDA cleared to treat with all three simultaneously. Right. And when you treat with all three simultaneously, you have the benefit of upregulating different cell types at different tissue depths all at the same time, because different chromophores, those are the molecules inside the cells that accept the wavelengths of light and utilize them to increase ATP. Different cells accept different wavelengths. So by having all three in there, you're pretty much getting everything in one shot. So a lot of times people will say, well, I use the blue dominant program for 15 minutes and the red dominant program for 15 minutes. With Celluma, you don't really need to do that. For the most part, if you use one or the other, they have adequate amounts of all three wavelengths to do the trick. I would say that if you're in the US, the wrinkle program is our red dominant program, and that will pretty much treat anything. Except if you were treating acne, you'd be better off with the acne program because there'd be more blue emitted. But otherwise, that red light program has so much blue that if there's an acne component to the condition, it's going to take care of it anyway. You don't need to switch between the programs, and that just makes it very convenient. It also switches off at the end of the program. So so when are your next courses? I think you mentioned that.
Well, in LA, we're shut down right now, so it'll be a while. I'm not sure when we'll be back up and running with in-person training. Seattle, I'm actually leaving this week to go do in-person training. They're open there, so I'm back to work and doing services and training there, thankfully. Hopefully soon. I really hope that we're able to reopen again soon.
For your customers then in LA, are you able to provide any online training or guidance in the meanwhile? Is that something?
I am. Yes, I do. I do have a lot of my coursework that I'm able to have them start online over Zoom. It's just that with permanent makeup, really in person, when you're first learning is really essential to learn the fundamentals and learn to work with skin. So unfortunately, I can't do all of that from Zoom at this point.
Zoom has been great, but it doesn't replace the in-person, especially where, you know, this is an art that requires tools and people, and it's not possible. So let me see if there's any. Let's see if there's anything in there. Is anyone here using Celluma for hair removal? So just Rachel Gray, just to answer your question on using Celluma for hair removal. So anytime that it's basically, that's another what I would call a very mild, slightly ablative procedure. You could, depending on how the skin reacts to hair removal, to the laser, or even to waxing, you could get a mild rash, you could get mild redness, a little inflammation and bumps. So using Celluma is used all the time following hair removal to settle down the skin, to reduce the redness and calm it down, and to reduce the inflammation. So that's a really good. Do you do anything like that, Erin?
I don't.
You don't. Okay.
No.
Okay. So I'm trying to see if there's any questions here we missed. So is this device flexible enough to treat the scalp? So it's flexible enough to actually wrap around any body part. So we're not FDA cleared for stimulating hair regrowth, but you can place it anywhere on the body. So it can even wrap around areas as small as your wrist. It can cover shoulder complex, a hip complex. You can wrap it around knees, or you can put it right over your head. So yes, you can definitely do that. Just see if there's anything else.
It's very flexible. It's very travel friendly too. I've been really pleased with that. It's I travel with it at least once or twice a month, so it's super convenient.
Yes, it is. It's super. I've traveled with up to 6 or 7 Celluma Pros at the same time because they're so lightweight. Even when I was traveling on planes, I could put them over my shoulder or in my carry-on, or just pack it around my clothes in a check bag. So very, very easy to travel with. And the travel authorities they never even ask.
No, they've never even mentioned it.
So somebody said here, which Celluma device would you recommend for an esthetician? Our favorite one, and probably our biggest seller by a long shot, is the Celluma Pro. And that's because the Pro is sized perfectly for over the face. It has, the stands are built in, so you can curve it in a U shape or preferably in a C shape. The reason I like the C shape is because it gets the side of the face nice and close as well, so it's not sitting too far away. It will still work, but the closer you can place it, the faster and better you're going to see benefits. So if you're curious about Celluma positioning at all, you should go to our YouTube channel, Celluma Light Therapy YouTube, and see the positioning tutorial. It was placed last summer, and that's just a great tutorial. It's only 9 minutes long, but it will teach you how to position any of the Celluma devices. But good question.
I have the Pro as well, and I love it.
You have the which one? Oh, the Pro.
The Pro.
Yeah, thank you. So somebody else here is, Patty says, I was using it after hair removal and it's brilliant. I also have spots. I also used to have spots, which is gone after first Celluma session. So that's very nice. So then Derma Refined Skin says, so in conclusion, they all emit the same intensity, but only differences in size and design. Yes, that's correct. All Celluma devices, whether you get our little handheld pod, which is about this size, right up to our full body devices, the power output per centimeter squared is exactly the same. So our Celluma pod is really just a mini Celluma Pro. The coverage is 1/10 of the size of the Celluma Pro, but you're getting the same everything, same wavelengths, same everything. So, but having the larger treatment area and the larger coverage is really important. So I think we got most of these questions. It's 12:41. Do you have anything you want to add there, Erin? Anything you thought of?
Not really. I mean, I think we've kind of covered everything.
Yeah, that was
just
great.
Excited to be able to share, my experience with it, and hopefully give other permanent makeup artists another tool to enhance their work and have better results.
Yeah, like you said, this is maybe something that maybe permanent makeup artists in general haven't thought about and would be interested in knowing more, so they can, reach out to you, reach out to us. We'd be happy.
Absolutely.
And yeah, definitely follow Erin anywhere you can so you can keep up with her courses. I wish I may have to come see you myself to fix
Please
my,
do.
my eyebrows when you're back in working in the Beverly Hills office. That would be lovely.
Oh, yes, I would love that. I would love
my
that.
eyebrows
Please
need a
do.
lot of help. Over plucked and destroyed them years ago. So there you go. All right, my dear. Well, this was a pleasure. It was lovely to chat with you. And thank you for reaching out, by the way. So we invite anybody that would be interested in sharing their personal Celluma experience to reach out to your dedicated Celluma specialist. And by the way, if you don't know that, everybody in the U.S. has a dedicated Celluma specialist. It's not somebody geographically maybe in your area, but it's somebody assigned to your area from our global headquarters. If you're in other countries watching, I know that Celluma Benelux was on here earlier, and they cover Luxembourg and Holland and Belgium. So we have distributors all over the world. So if you're not sure who to speak with, just send us an email at info@celluma.com, and we will redirect you to somebody that can take care of you. So don't be shy. Reach out and talk to us. We'd love to hear from you. And
I'm happy to answer questions as well. If there's permanent makeup artists out there that have specific questions on how to use the device or anything at all, I'm really big on connecting with other people in the community and also just being a resource in the community. So please don't hesitate.
Hasn't this been a great time during the lockdown and during COVID to sort of share the support and,
yes.
the knowledge and the education? I'll be honest with you, I was so busy before COVID. I on the road all the time, and I have found my time to be actually much more productive. And then we're able to do this kind of thing, which has been very, very popular with our community. And it's a great way to educate and share in a very real way. We're big on integrity and authenticity at this company. So we love sharing with people like Erin, because it's not, you're not hearing it from me, but we're hearing it direct from an authentic practitioner. So we love that. So I'm so glad that you reached out, Erin. That was lovely too.
Oh yeah, of course. Thank you. Thank you so much.
Okay, well, I guess we're saying goodbye, everybody. Thank you for your questions.
All right.
Stay tuned for more. Bye.
Bye.
Bye-bye.